Men over 60. Listen closely. If you've been waking up at night to use the bathroom, if your stream feels weaker than it used to, or if your energy and confidence have slowly faded away, this message is for you. Because here's the truth. Prostate problems aren't an unavoidable part of aging. They're a warning sign. And new studies are showing that you can actually prevent or even reverse prostate issues with a few simple daily habits. No pills, no surgery, and no side effects. In fact, one of these habits takes less than 60 seconds in the morning, and it helps improve blood flow, balance hormones, and reduce prostate inflammation, naturally. But most men never hear about it. Why? Because it doesn't make pharmaceutical companies any money. So before you reach for another supplement or prescription, stop. In today's video, Dr. Melisa Monroe is revealing 5 proven daily habits that protect your prostate after 60. Habits backed by science, used by thousands of her patients, and easy enough to do from home. You'll learn the hidden connection between your gut and your prostate, the morning mistake that silently increases your risk of enlargement, and a natural evening drink that helps you sleep through the night without interruptions. So grab a glass of water, take a seat, and listen closely, because these next few minutes could help you regain control, confidence, and comfort again. Starting today. Dr. Melisa Monroe has spent over 2 decades helping men over 50 restore their vitality and protect their health using natural, science-backed methods. As a board-certified wellness specialist and integrative health doctor, she's worked with thousands of patients dealing with prostate enlargement, low energy, and hormonal decline. And she's seen firsthand that the body has a powerful ability to heal when given the right daily habits. She often reminds her patients, medication can manage symptoms, but habits restore balance. Modern research supports this truth. Studies from Harvard, Johns Hopkins, and the Mayo Clinic all point to lifestyle factors, like diet, circulation, inflammation, and stress, as major drivers of prostate health. Even small, consistent actions can dramatically lower inflammation and improve urinary comfort. Dr. Monroe combines her medical background with holistic strategies, simple food choices, breathing techniques, movement routines, and natural nutrients to help men maintain prostate health naturally. So, in this video, you're not just hearing vague advice, you're hearing clinically grounded methods tested in real patients and verified by medical science. Let's dive into how your prostate works, why problems begin after 60, and the 5 daily habits that can keep it strong, pain-free, and youthful. Let's start with what's really happening inside your body after 60, because understanding why prostate problems develop is the first step to preventing them. The prostate is a small gland, about the size of a walnut, located just below the bladder. Its job is to produce fluid that protects and nourishes sperm. But as men age, that little gland becomes sensitive to changes in hormones, circulation, and inflammation. Now, here's the tricky part. These changes don't happen overnight. They build up silently over years, and most men ignore the early warning signs. Slower flow, nighttime urination, or that constant feeling of not fully emptying the bladder. So what's really going on? Let's break it down simply. First, the hormonal shift after 50. After age 50, testosterone levels naturally begin to decline. That's normal. But what many men don't realize is that an enzyme called 5-alpha reductase starts converting more of their remaining testosterone into a more potent form called DHT, dihydrotestosterone. Now, DHT isn't bad in small amounts. It's important for hair growth and muscle strength. But when too much builds up in the prostate, it acts like fertilizer. It makes those cells grow, swell, and tighten around the urethra. That's why your stream weakens. It's not just age, it's hormonal imbalance. And to make things worse, stress hormones like cortisol can amplify this effect, further reducing free testosterone and worsening inflammation. Second, the circulation problem. Your prostate depends on strong, healthy blood flow, just like your heart or brain. But most men over 60 are less active, sit for longer hours, and often have poor pelvic circulation. Imagine a garden hose that's been bent for years. The water still flows, but it's sluggish and uneven. That's what happens to your pelvic blood vessels when they're compressed or clogged with inflammation. Poor circulation means less oxygen, less nutrient delivery, and slower detoxification in the prostate area. Over time, waste products build up, leading to that constant dull ache or pressure you might feel. Third, inflammation, the silent enemy. Inflammation is your body's natural defense mechanism, but when it lingers, it becomes destructive. Chronic inflammation in the prostate, called prostatitis, can happen even without infection. It's driven by poor diet, stress, and lack of movement. When inflammation sticks around, it causes swelling and stiffness in the gland. This pressure can irritate nearby nerves, leading to pain, burning, or urinary discomfort. But here's the interesting part. Studies show that the gut and the prostate are deeply connected through what scientists call the gut-prostate axis. Fourth, the gut-prostate connection. Your gut microbiome, the trillions of bacteria living inside you, influences almost every hormone and immune signal in your body. When your gut bacteria become unbalanced, it leads to higher inflammation throughout your system, including in the prostate. Think of your gut as the command center of inflammation. A diet high in sugar, processed meats, or alcohol feeds the bad bacteria, which then send inflammatory signals that can irritate the prostate. This is why men who clean up their diet, adding more fiber, greens, and fermented foods, often notice their urinary symptoms improve within weeks. It's not magic, it's biochemistry. Fifth, the modern lifestyle trap. Here's what most men don't realize. The modern lifestyle almost guarantees prostate stress. Sitting for long hours restricts blood flow to the pelvic area. High-stress jobs keep cortisol high, suppressing testosterone. Processed foods create inflammation and block hormonal receptors. Lack of quality sleep prevents your body from detoxing and repairing tissues overnight. It's a perfect storm. Hormonal imbalance, low circulation, and high inflammation. That's why pills and quick fixes rarely work long-term. They might relax the muscles or reduce swelling temporarily, but unless you address the root causes, the problems return. Sixth, the good news. Your body can heal. The prostate is remarkably responsive to lifestyle changes. When you balance hormones, move your body, and eat anti-inflammatory foods, blood flow improves and tissue stress decreases. In fact, in clinical studies, men who adopted consistent lifestyle habits, walking, stretching, better nutrition, saw significant improvements in urinary comfort, energy, and sexual function within just 8 to 12 weeks. One patient of Dr. Monroe's, a 68-year-old retired teacher named Mark, came in frustrated after years of medication with little relief. His biggest complaint was waking up 5 times a night to urinate. Dr. Monroe worked with him to clean up his diet, teach him a simple breathing exercise, and add gentle morning stretches. Within 2 months, he was sleeping through the night, his energy returned, and his doctor confirmed a reduction in prostate swelling. That's the power of consistency and understanding your body. Seventh, the role of hormones and mindset. Hormones respond not just to what you eat, but also to how you think. Chronic stress, fear, and anxiety keep your body in fight or flight mode, flooding it with cortisol, which directly blocks testosterone production. That's why calm breathing, sunlight exposure, and gratitude practices aren't just feel-good extras. They're tools that reshape your internal chemistry. Men who learn to relax, eat mindfully, and move with purpose often see their energy, libido, and prostate health improve together. So when Dr. Monroe says prostate health is whole body health, she means it literally. It's about aligning your hormones, circulation, digestion, and mindset so your body can restore itself naturally. 8. A quick recap. Here's what you now understand. The prostate enlarges due to excess DHT, poor blood flow, and chronic inflammation. These problems are fueled by lifestyle, not age alone. Your gut health, movement, and mindset play massive roles in regulating prostate balance. Natural daily habits can calm inflammation, improve circulation, and restore hormonal balance, all without side effects. In the next part, Dr. Monroe will walk you through 5 proven, easy-to-follow daily habits that target these root causes, so you can finally take control of your prostate health, naturally and confidently. Now that you understand what's really driving prostate issues after 60, let's talk about what you can do, starting today. These are Dr. Melisa Monroe's 5 proven daily habits for maintaining a healthy prostate, improving urinary comfort, and regaining vitality naturally. Habit number 1: the warm morning circulation routine. Start your day by waking up your pelvic blood flow. Before you even reach for your phone, sit at the edge of your bed and perform 60 seconds of deep belly breathing. In through the nose, out through the mouth. Then gently roll your hips in circles, stretch your thighs, and take a short 5-minute walk. This simple movement increases oxygen and blood flow to the prostate, reducing stiffness and inflammation. It's like flushing out toxins before they settle. Number 2. The anti-inflammatory breakfast: skip processed meats and heavy dairy first thing in the morning. Instead, go for a prostate protective combo: oatmeal with ground flaxseed, a handful of walnuts, and a sprinkle of turmeric or cinnamon. These foods are rich in lignans, omega-3s, and anti-inflammatory compounds that lower DHT naturally. Plus, they keep your blood sugar steady, which helps your hormones stay balanced. Number 3, hydrate smart, but strategically. Hydration is key, but timing matters. Drink most of your water between sunrise and late afternoon. After 7 p.m., slow down your intake to prevent nighttime bathroom trips. And whenever possible, sip on green tea or nettle tea, both shown in studies to reduce prostate swelling. 4. The gut reset. Once a day, eat something that feeds your gut bacteria, like plain yogurt, kefir, sauerkraut, or a small bowl of fiber-rich vegetables. Healthy gut flora reduce systemic inflammation, easing pressure on the prostate. 5. The evening de-stress ritual. End your day by lowering cortisol. Take 10 minutes to stretch, breathe, or simply sit quietly before bed. Even better, write down 3 things you're grateful for. This lowers stress hormones, boosts testosterone, and helps your prostate and your whole body repair overnight. Start small, stay consistent, and within weeks, you'll begin to feel the difference. Better flow, deeper sleep, and renewed energy. If you've been struggling with frequent trips to the bathroom, discomfort, or just that constant worry about your prostate, take a deep breath. You're not alone. Millions of men over 60 experience the same challenges, and most of them have been told, it's just part of getting older. But that's not the full story. Your body is incredibly adaptive. It listens, it responds, and it heals, especially when you give it the right signals. Those simple daily habits, moving your body, eating anti-inflammatory foods, managing stress, and supporting your gut, they're not just random tips. They're powerful tools that retrain your body to balance itself again. Remember, improvement doesn't always happen overnight. Some men notice changes in a week. For others, it takes a few months. But the key is consistency. Every deep breath you take, every better meal you eat, every moment you choose calm over stress, it all adds up. Dr. Melisa Monroe often tells her patients, healing is a direction, not a destination. That means every small positive step counts. So instead of worrying about the past or fearing the future, focus on what you can do right now, today. Because your prostate health isn't out of your control. With the right habits and mindset, you can regain comfort, confidence, and vitality, and live your later years feeling lighter, stronger, and fully in charge of your health again. If you found this video helpful, take a moment to share it with another man over 50 who might be silently struggling with the same issues. Sometimes, the smallest bit of knowledge can change someone's life. And if you haven't yet, subscribe to Dr. Melisa Monroe's channel. This is where you'll find practical, doctor-approved natural remedies designed to help you age with strength, confidence, and vitality. Dr. Monroe uploads new videos every week on senior health, natural hormone balance, and science-backed tips for longevity. Leave a comment below and let us know. Which of these habits will you start today? Your story might inspire someone else to begin their healing journey too. And stay tuned. In the next video, Dr. Monroe will reveal 3 everyday foods that secretly lower testosterone after 50, and how you can easily replace them for better energy and performance.